Hi, Mr. Sloan. Carrie, I'm Carolyn Fordham from the Department of Patient Safety. It's nice to meet you. This is my colleague, Lynn.
Hi, I'm Lynn. Nice to meet you. Nice to meet you.
Do you have a few minutes to talk right now?
Yeah.
Okay, great. Thanks.
Getting up on the time, right, Dad?
How are you feeling?
I'm a little tired that night. I'm really not myself.
Of course. I hope that we can help you to feel more yourself and get you home soon. I'm here to talk a little bit more about the chest x-ray that the ED doctor came and talked to you about, that we missed the finding of cancer on it when you were here originally for your stroke. I just want to say, first of all, that I'm so sorry that we missed this. We take this really seriously. It is not acceptable, and it is our responsibility to fix this. Lynn here and I work together with a big team of people in the hospital to identify how this kind of thing could have happened and how to prevent it in the future. But our other job that's very important is to figure out how it's impacted you personally, what this miss has caused in terms of your cancer prognosis, and also to just figure out how we can actually help you right now with what you need. Is there anything that you are thinking right now or questions that you have?
No, I just can't believe this happened when you took such good care of him before, and now he's got to deal with cancer. And if it was picked up, the prognosis would be better.
You know, he's suffering. He can't take care of my mother anymore. My brother and I have been trying to help out, but it's stressful, and I think this affects his health and his, looking at treatment.
Mm-hmm. It's exactly right.
And I hope you can make this good for him, because this has not been fun for my family and I, and my father's suffering.
I completely understand. I'm so sorry, and I want to be able to do all of those things for you, and that's what we are going to do. So right now, we can't tell you much about how much the delay in finding that chest x-ray result has actually impacted your cancer, but that's one of the first jobs that we have, is to make sure that we get all of your oncology experts looking at this to get you the best plan that you can and figure out how much that miss has impacted you. And then because of that, also part of my job is to figure out how can we help you support your wife? How can we help you get the resources you need so that you can get the care you need right away? Lynn is also part of this team, so she's going to help me find those answers and any other questions that you have. So Lynn will be your main contact. As you leave the hospital, you may have questions or concerns or worries, and we want you to be able to be connected to us at all times. So Lynn is going to be that point of contact. And of course, I'm available as well too.
Yes. Here's my card. Please feel free to reach out at any time. I will be in touch later with any information that comes out of the review. In the meantime, is there any way we can help you?
I'm off. My wife's only caretaker. I can take care of her. I just can't.
I completely understand. Give me some time to talk to my team members, and we'll get back to you on how we can help. In the meantime, is there someone that can take care of her right now?
You know, there's my son, but he can't take this on right now.
Well, we can certainly work together to find someone to help take care of your wife, whether that's visiting nurse or some other thing that will help you to be able to feel like she's getting the care she needs.
Is there anything else you think you need right now, Deb?
No. Thank you.
Okay. Well, you have our contact information, and again, we are so sorry.
So if we have any questions, we call Lynn.
Yes.
You're going to be out. Okay. When do you think you'll be done with this investigation? How long does that take?
It's a really good question. It usually takes us around 30 days, but we try to do it as soon as possible. So we certainly will find out more about your particular diagnosis and how we can help you much faster than that. But if you're talking about our plans to figure out what are the causes to these problems and how are we going to prevent them in our own system, sometimes that does take a while, because we have a lot of systems that interact, and we want to make sure we know exactly how it happened and how to prevent them. So it does take a little bit. Okay. Anything else we can help you with right now?
Thank you.
Okay. Thank you so much for taking the time to talk to us.
Thank you.